Hello, my name is Neil and I'm one of the physical therapists on the team here. I'm going to spend about 10 minutes explaining what you need to do between now and your surgery to improve your recovery and what to expect from physical therapy after surgery. Our job is to make sure that you are safely able to do what you need to do to return home after your surgery. The first thing we want you to do today is to walk through your house as if you had a walker. They are usually about 25 inches wide. You'll need to make sure there is room for you to move around your house with your walker. For example, between your bed and the wall or the dresser, into the bathroom, and then the living room seating area. Sometimes you may need to remove the bathroom door and hang a curtain, or move the recliner so you can fit the walker between it and the sofa. It's much easier to do this now before surgery than on the first day that you get home. The second thing we want you to do is pick up your throw rugs. We understand that they serve a purpose, but they are a fall risk. Falling is one of the primary ways people damage their surgical site, and we want you to do everything possible to minimize that risk. If you have more than 2 steps going into your home, we want you to make sure you have at least one rail to get up those steps. You'll be relying on your walker to move on level surfaces, so you can see why we'd like you to have a rail to support you going up and down stairs. Now for your exercises.
The first exercise that we're going to do is called an ankle pump. We're going to do this on the bed or on a couch at home. We want you to be able to stretch your legs out straight, and you're going to pull your ankles back towards you and then point your ankles like a ballerina away from you. We want you to pump your ankles up and down nice and smoothly, not slow and not fast, in a steady motion. Just like that. We're going to do 10 repetitions of these exercises twice a day, is what we recommend. The next exercise is the Quadricep Set, or the quad set. The quad muscles are the muscles on the front of your thigh, and what she's going to do is press the back of her knee down into the bed so that the surface area of the back of the knee comes in contact with the bed. The kneecap will move up and the muscles in the thigh will become a little bit more prominent with this exercise, but you're not going to see a lot of movement. And then I want you to relax those muscles. When she relaxes, her knees pop up just a very little bit. We want you to do both legs at the same time, so press down and tighten, and she's going to hold for a 1, 2, 3 count and then relax. And press down again and hold 1, 2, 3 and relax. If you're having a knee replacement and your knee does not straighten out this much, just do the best that you can. If it causes you pain, we want you to stop. We don't want to cause any more pain than you already might be exhibiting prior to your surgery. If you can do 5 repetitions instead of 10, do that instead. Just do as much as you can in preparation for your surgery. The next exercise is a glute set, or a butt squeeze. So she's going to squeeze the muscles on the back of her hips, nice and tight and close together, and then relax. Good. And this is a gentle squeeze of the back of the hips, squeeze, and then relax. Squeeze and relax. With this exercise, you can hold for a count of 3, just like you did on the last exercise, the Quadricep Set. Up to this point, we've done both legs together as an exercise. The next exercise that we're going to do, we'll do one leg at a time. This is called a heel slide. She's going to keep her heel in contact with the bed, bend the knee, and slide the heel up towards her body, just like that, and back out straight. One leg at a time, 10 repetitions each, then you'll repeat on the other side. If for any reason you can't bring your leg up that high, bring it up as far as you can, and then slide it back out straight. Good. Now let's try the other side. Slide up and back out. Again, keep the heel in contact with the bed. The next exercise is called a long arc quad. It's also called a deep arc quad or a knee extension exercise. So sitting in a chair with her legs supported, her femurs supported, she's going to extend her lower leg and straighten out the knee. Hold for 2 count and then slowly lower down back to the starting position. Straighten all the way out and back down nice and slow and controlled. 10 repetitions, twice a day, both legs. Okay, let's move on to the other leg. Straighten out as best as you can. If you can't straighten your leg all the way out, straighten it out as straight as you can get it. So the next exercise is for your arms. We use our arms a lot in the total joint replacement, both by using the walker and getting in and out of bed. So at this point, I'm going to have her move to the edge of the chair here, and with her hands on the armrest, she's going to extend her elbows and come all the way up so that the elbows are almost straight. Do not lock out the elbows. From here, she's going to lower down nice and slowly, and then press back up, and then lower down nice and slowly. Now, if you have any problems with shoulder pain or elbow pain in doing this exercise, we want you to stop and we can do a modified version. The modified version would start with the arms all the way straight and then lower down just a little bit and then push back up. And again, lower just a little bit and push back up. Good. And now if you're able to tolerate, we do want you to come all the way down. Good. And press back up. And again, this is preparing you for using the walker that you'll be using post-surgery. The exercises that we just reviewed can be found in this pamphlet that will be available to you in the NHRMC MyChart portal or will be emailed to you. The exercises are on page 8. If we don't see you the day of surgery, we'll see you the following morning for your physical therapy evaluation. We will look forward to working with you. We would like for you to wear non-skid footwear and some comfortable clothing. Thanks for choosing us, and we look forward to working with you.
What do we do in physical therapy? In your first visit, we're going to ask you how you were doing before surgery. Did you use a cane or a walker? Did you need help with anything? Then we're going to find out what you need to do to go home. Do you have steps to get into your house? Is your bedroom or bathroom upstairs? Do you have a tub shower or a walk-in shower? Once we know how you were doing and what you need to do, then we find out what you're able to do now. We evaluate how much help you need to sit up at the edge of the bed, stand up, and walk. You might take a few steps, or you might walk in the hallway. If you're walking very well and safely, we may even try steps with you. There are some patients who become lightheaded, dizzy, or nauseous at some point in this progression. If this happens to you, we will have you either lay back down or sit in the recliner, depending on where we are. Don't get frustrated. It's just the effects of the medication and the anesthesia. It has nothing to do with your age, your pain tolerance, or your fitness level. It will be better the next time we see you. Your safety is always our first priority. Once we see what you're able to do, then we set up a plan of care to help you accomplish what you need to do to go home. Sometimes you're able to do all these things on the first visit and we don't need to see you again. Sometimes you will need multiple visits. It makes sense that none of you are in identical situations, so you shouldn't have identical plans. Some of you will be seen 1 session, some 6, depending on what you need for a safe discharge. While you are in the hospital, we will see you every day to ensure progression towards your goals for a safe discharge home. Your schedule will most likely be different from day to day. We will communicate with your nurse to make sure that you have had your pain medications you need. Thank you for your time. I hope this was helpful. Congratulations on your decision, and thank you for choosing us. I hope to see you soon, and have a good day.